Okay, so today we're preparing to give my patient 2 injections, but first we're gonna go over her chart. Our patient is Sam Johnson, date of birth 18XX. She does not have any allergies. She's a full cold and a high fall risk. She was admitted to the med-surg unit for dehydration and a fall. Her past medical history is hypertension and asthma. Her medications are furosemide 20 milligrams by mouth daily, albuterol inhaler 2 puffs as needed for shortness of breath, and acetaminophen 500 milligrams as needed for pain. All of her vital signs are within normal range, and her head to toe is normal besides the amber urine, but we expect that to be noted in dehydration. So today we are going to be giving her flu vaccine and her heparin, which are both due now, but we're going to go in and ask her if she would like those first.
Come in.
Hi, Sam. Can you state your name and date of birth for me?
Sam Johnson, 18XX.
Okay, and I'm just going to check that wristband here to confirm. Okay, perfect. First thing, do you have any drug allergies that we need to know about?
No.
Okay. So today we have intramuscular injection, which is the flu shot. Have you had that this year yet?
No.
Okay, would you like to get that today?
Yes, please.
Okay, and then our next one is heparin. Would you like to get that today too? It's a subcutaneous.
Sure.
Okay. So for that flu shot, we can either put it in the thigh, the buttocks, or the deltoid. Which one would you prefer?
The deltoid.
Okay, and your left or right arm?
Left, please.
Okay. And then for that subcutaneous, we can either put it in the fatty tissue behind your arm, abdomen, or your thighs. Where would you like that today?
My abdomen.
Okay, sounds good. Do you have any other questions or do you need anything?
No, thank you.
Okay. Bed is in lowest position. She has her collet and she doesn't need anything. So now we're back in the med room. We're gonna conduct our first med check for the flu zone. So we have flu zone. This is to prevent influenza. It is 0.5 milliliters for an IM injection. For Sam Johnson. It has not been administered yet, and so we're gonna give that now. And then we're gonna check our second med, which is heparin. So heparin. This is to prevent blood clots, and we're gonna give 5,000 units per 1 milliliter, which is 5,000 units per milliliter. This will be subcutaneously, and it's going to be for Sam Johnson, and it is due now, and it was last administered yesterday. We're gonna do our second med check for the flu zone. So flu zone. This is to prevent influenza. We have 0.5 milliliters. It's intramuscular. It's for Sam Johnson, and it is due now since it has not been given yet this year. We're gonna do our second med check on heparin. So we have heparin. This is to prevent blood clots. We have 5,000 units per 1 milliliter. It is for Sam Johnson. This will be administered subcutaneously, and it is due now since it was last administered yesterday. So looking at this package, it's not cracked, it doesn't seem to be contaminated, the lid's still on, and it's not cloudy, and it's not expired. This one isn't expired, it's not cracked, cloudy, and the lid is still on as well. Okay, so now we're going to drop our medication, so I'm gonna come over and grab a pair of gloves. Okay, so the first one we're going to draw up is the flu zone. So we are going to take our syringe. Well, first we're going to clean the top of this bottle for 15 seconds, and then we're gonna let it air dry for a second. Then we're gonna open our syringe and grab our blunt tipped needle to draw up the medication. If I can get it open. Okay, there we go. Okay, so now that we have our blunt tip needle open, you're gonna take the syringe and put it on. We're gonna take the cap off, and since it's 0.5 milliliters, we are going to want to inject that amount of air into the vial. We're gonna make sure there's no air bubbles, and then we're going to recap, and that is 0.5 milliliters. And then we are going to take a 25 gauge by 1 inch for the intramuscular one needle. If the client was obese, we would think about using a 1 1/2 gauge needle. So I'm just gonna recap that again like that because I accidentally took it off. Okay, and now we're gonna put this on. Okay. And then now we're gonna draw up our heparin. We're gonna take our syringe, our blunt tip needle to draw it up, okay, so it is 1 milliliter, so we are gonna take this off, draw up 1 milliliter of air, put that in here, and then draw up our 1 milliliter of solution. We're gonna take that and get rid of any air bubbles that we have here. Okay, and then we are going to recap it. Oh. Okay, there we go. And then we have 1 milliliter of solution. So now we're gonna take the 25 gauge by 5/8. We're gonna remove the blunt tip needle. We're gonna put that on and put that here. For obese people, we would think about using a 1-inch needle and possibly a 90-degree angle, and we'd want to go under their like little flab of fat that they have. And then I did it for the first one, but you're also going to clean the top of this for 15 seconds and then let it air dry for a second. So now we are gonna create our labels so we don't get this mixed up. So it's for Sam Johnson. It is Fluzone 0.5 milliliter for an IM injection. And then we're gonna put that on here. Okay, so then our second one is also still for Sam Johnson. We are going to put the heparin on here. It is 5,000 units per 1 milliliter. And this one is the subcutaneous one. Okay. So now we're gonna go into our patient's room and administer these. Knock, knock.
Hello.
Hi, Sam. Can I have you confirm your name and date of birth for me one more time?
Sam Johnson, 18XX.
Okay, let me just take a look at that wristband. All right, and then one more time, we don't have any allergies, right?
Correct.
Okay. So we're gonna complete our third med check here for the flu zone. So we have flu zone, which is indicated for preventing the flu. 0.5 milliliters for 0.5 milliliters for Sam Johnson. It is an IM injection that is due now because it has not been given this year. We are gonna do our third med check on heparin, which we have heparin. This is to prevent blood clots. 5,000 units per 1 milliliter, which we have 5,000 units per 1 milliliter. We have Sam Johnson. This is going to be subcutaneously, and this is due now since it was last administered yesterday. Okay. So, we're gonna do the flu zone first. So we are going to scan our patient's wristband here and scan our medication, and it was a match. Sam, I'm gonna sit the head of your bed up here a little bit. Put your head up just a tad bit. And we're gonna pull this down so we have better access. So this first shot is going to go into your deltoid, and some side effects that we want to look for is just redness and swelling at the site, and then you also might feel fatigued and have a headache the next day. Does that sound okay?
Okay.
All right. So first, we're going to disinfect your arm here. And we're gonna let that air dry for a second. Okay. We're gonna take this off. We're gonna move the skin over, and it's gonna go straight in 90-degree angle. Push in that medication. And pull it straight out. And then we're gonna put that skin back over. And we're gonna close that. And we are gonna put our needles in the sharps. And we would put a Band-Aid over the injection site. Okay, Sam, are you ready for your next injection here?
Yep.
Okay. So this one's gonna be in the abdomen. It's the heparin. This is for your, to prevent blood clots. You could notice, you may bleed easier, you may have a headache, and you may notice some abnormal bruises. Okay. We're gonna clean the site here. Let it air dry for a second. Okay. This one we're gonna go in at a 45-degree angle. Administer that medication. Pull it straight back. Put the safety cap on. We're gonna put a Band-Aid over that. Provide the client with some more privacy there. Put this in our sharps. How are you feeling after that, Sam?
Okay.
Okay. So we're gonna put this back up. I'm gonna lower this back down to a comfortable position. And do you need anything else?
Nope.
Okay. And then after each shot is given, we would document that it was given. Okay, Sam, I'll be back in about 15 minutes to check on you, okay?
Okay.
in about 15 minutes.
Hello.
Hello. How are you feeling?
Good.
Okay. You don't notice any like itching or hives or anything?
Nope.
Okay, awesome. Do you need anything else?
No, thank you.
All right.